I think that the next two slides are maybe the most important takeaway from my lecture. I think that it could be pretty boring in the field of the nutritional treatment just to see food and food choices as something which is 100% physical and technical. What I'm trying to do here in the next two following slides is to demonstrate the association between food selections, especially food selections of grains, with life choices that everybody takes during his life. And I would like to show in this first slide the sweetness at the beginning, how people lean towards specific choices in life, and also how people select to include a lot of cereal grains into the diet, and what are the benefits that are associated with these selections. But in the next slide, I'm going to talk also about the prices of life choices and how they manifest in our emotional level, and also how they are mirrored and experienced in our digestive system. So I'm trying to draw kind of connection between life choices and having grains, as we remember, according to the Confucian and also according to the Taoist traditions. The grains are associated with being part of civilization, and I'm going to show the good aspects of being part of civilization and eating and having grains, and also the dark sides of being part of civilization and paying the health price of having too many cereal grains in your diet. And the topic of our lecture today is when the heart burns, an integrated approach for the treatment of esophageal reflux. It's not necessarily a stomach problem, or as I wrote here, it's not the stomach dummy. And what do I mean here? I just mean that you cannot just use the old tricks of rectifying the stomach in order to address all of the stomach problems. If you just use all kinds of cooling herbs or stomach yin and nourishing herbs, or all kinds of herbs that relax maybe the liver, that is the partner or the neighbor of the stomach, it's not going to work every time. And then in relation to the lower digestive tract, there are also two groups of syndromes. The first one, I call them the internal spleen syndrome. Actually, it's not internal spleen, it's internal pancreas. For example, if you're talking about the sweet foods, most people think that sweet foods are only relaxing the upper sphincter of the stomach. I'm going to show you another pathomechanism that causes sweet foods to trigger a GERD. Also, when we are talking about spicy foods, people think it's because of the acidity of these foods, but I'm going to point at another factor that in these acidic foods that cause GERD. Also, having grains was understood as a mean to experience kind of downfall that takes one back to the human realms of possession and greed and looking for money. And this is something that the Taoist scholars tended to separate themselves from. I hope you will enjoy and gain some insight through this lecture.